and we are going to talk about some of the major factors associated with the immune response for chapter 22. So let's dive into this and look at some of the major structures associated with the lymphatic system. When we talk about the lymphatic system, it is a collection of various different structures all over the body. They are not really isolated, as you can tell from the picture. They are not isolated to one little spot like central nervous system with the brain or the lungs or the heart, really just within the thoracic cavity there. So these are things kind of found all over. They do a number of things function-wise. They check, recheck, recheck, check, recheck again fluids within the body. They're looking for foreign invaders, okay? And by foreign invaders, viruses, bacteria, parasites, the secretions of all those things. And really, when we talk about that, we're talking about, excuse me, foreign antigens, okay? Antigens are those things on the surface of cells, those markers that let you know that it's you and not somebody else, okay? So they are going to be looking at fluid over and over and over again and checking for it to be able to mount an immune response, all right? Well, you're like, okay, where I don't see that up here. Well, lymphocytes and various different immune cells are those physical structures, those physical pieces within the lymphatic system that are mounting the immune response. Our T lymphocytes, our B lymphocytes, all right? They're going to be mounting the immune response. They hang out in various different structures, lymph nodes, tonsils, okay? Diffuse associated tissues. They're just sitting there waiting to be exposed to a foreign invader so it can become competent and then kill. So that's one function. Another function, we hinted at it when we looked at capillary exchange of fluids, all right? It can also return excessive fluid within those tissues, within those capillary beds, to the circulatory system. Not all of the fluid that gets pushed out in the capillary bed gets reabsorbed on the venous side. There's a small little bit of fluid that stays there. That gets picked up by the lymphatic system. And the lymphatic system helps to return that fluid back to the circulatory system up near the heart. We have, as I stated, a number of structures scattered throughout the body. They consist of various different types of lymphatic vessels, of which there are several, and we'll hint at what all those are. Various different lymphatic issues. That should be lymphatic tissues. Let's put a T right there. That should be lymphatic tissues. But wouldn't that suck if your lymph system had issues already? And then a couple of important organs associated with the lymphatic system. It has its own fluid. Hold yourself. Called lymphatic fluid. It's the fluid that flows throughout the lymphatic system. Okay, it's called lymphatic fluid. Shocking. So hopefully pretty basic, a pretty basic introduction there. When we look at lymph, it's pretty similar to what we see with blood. You know, has some water, has some dissolved solutes in it. There could be a little bit of protein. There can be some cellular debris. There can be some pathogens, some foreign invaders. And we can have some cancer cells in it as well. So all of that can be components of what is called lymph or lymphatic fluid. All of this fluid gets picked up by these lymphatic vessels, and the very beginning of the lymphatic vasculature, okay, vessels of the lymphatic system, starts in the capillary bed. This is different from the circulatory system where the first ones are your bigger arteries and veins, right? The big arteries, those elastic arteries, then muscular, and then arterioles, and yada, yada, yada. Here, the lymphatic system begins in the capillary bed, and it starts out as lymphatic capillaries, okay? These are very small. Hopefully by the name capillaries, you would already put small associated with that. And these are closed-ended vessels. So they just, where your capillary bed is, I'm just going to draw a capillary bed. Okay, this is a capillary bed. All right. And your lymphatic vessels, your lymphatic capillaries, just start right there. Okay. There you go. And then back towards the heart. These very small, and there's a better picture on the next slide if you want to see a more artistic picture. These small blind-ended tubes are there to absorb that excess fluid that's within the space, and that was referred to as interstitial fluid, and that's what it absorbs. As soon as that interstitial fluid gets absorbed into the lymphatic capillary, it's called lymph. That's it. When you look at them, and there's a picture here on this slide, it's slightly bigger than a vein, but it's only one layer thick. That's really the big difference here between a lymphatic vessel and a vein. It's very, 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 very thin. And as you can kind of see here, here's this, I'm just going to highlight this. We have overlapping that occurs here. Okay, so we have all this overlapping that occurs here within these lymphatic capillaries. And it's that overlap, okay, that allows fluid from the interstitium, the space around, to flow easily within that lymphatic capillary. And as soon as the fluid level rises, well, what the hell does it think? It shuts the door. Okay. And as fluid is filling it up, it shuts it up. Okay. And then it gets moved along. And as the pressure within this system, this little blind-ended capillary drops, that little overlap opens back up again and fluid starts to come on in, and it rises and falls and rises and falls. So as soon as fluid enters into this little lymphatic capillary, that overlap gets shut. Fluid gets pushed forward. Pressure within that little bitty capillary drops, so that overlap opens back up again, and more lymphatic or interstitial fluid is allowed to enter this lymphatic capillary. As soon as stuff enters into this lymphatic capillary, it is within the lymphatic system and it is not coming back out. Okay. Stuff can easily get in. Some things don't easily get out. Okay. If you have a parasitic worm infection, they can get in the lymphatic system pretty easily. They don't get out very easily though. Okay. Elephantitis is a filarial worm infection that gets into your lymphatic vessels and blocks them up, and you get massive lymphedema, get pachyderm-like skin, hence elephantitis. Okay, cancer cells, they can get in there. They can clump up. They can easily get in. They don't necessarily easily get out. Okay, so when stuff enters, it enters. And then it goes through the entire system until it gets dumped back into the circulatory system, which happens around the subclavian veins near the heart. Okay. But This interstitial fluid enters and everything enters and it goes forward through the system. We have some very specialized lymphatic capillaries within the small intestines, well, GI tract, small intestine, large intestine. And these are the lacteals. And these are predominantly within the small intestine, but you can see a few within the large intestine as well. And these lacteals absorb lipid-soluble substances from the gastrointestinal tract. That's what GI stands for. It's a fancy way to say their digestive tract, all right? These are specific lymphatic capillaries found within the small and large intestine. Okay. So these are some specialized lymphatic capillaries. They are specialized because of what they do, and they absorb fat-soluble substances, vitamins A, D, E, and K, triglycerides, fats. Anything fat-soluble, lipid-soluble gets absorbed by the lacteals within the small intestine, a little bit within the large intestine as well. Movement is all based on pressure. For the most part, lymphatic vessels are very delicate. They don't really have a massive amount of tunica media associated with them at all. So these guys are going to be pushing fluid forward through the system on more of a pressure gradient system. When the pressure is low within the lymphatic capillary, like I explained earlier, fluid enters. As soon as the pressure within that lymphatic capillary rises, it closes off. But as soon as you contract that muscle, that's going to help propel lymphatic fluid forward through the system. We talked about respiratory pump and skeletal muscle pump when we were talking about venous flow. That same thing is going to be happening here in spades, okay? Veins have some tunica media, so they have some ability to vasoconstrict. Lymphatic capillaries, lymphatic vessels, they don't have a huge, massive amount of tunica media at all. So these guys or girls are always going to be dependent upon pressure changes, okay? We go from smaller vessels to bigger vessels, okay? That's going to propel fluid forward through the system. Every time we get up and move around, okay, we are going to be moving fluid forward through these systems. These vessels are everywhere. They're in your legs. They're around all of your joints. Okay. Have you ever fought off something? Have you ever been sick? Of course you have. One of the things that you feel when you're sick, right? You feel just sore and achy. Why the hell do you feel sore and achy? Well, your body's fighting off something. And when you fight off something, an immune response, that's the lymphatic system. All of these causes, these agents, bacteria, virus, whatever, have gotten into this lymphatic system, picked up in that interstitial fluid in that lymphatic capillary. And it's going through all of these structures that we're going to be talking about here in a little bit. And one of the primary responses for the immune response is inflammation. Well, all of these little lymph nodes get swollen and inflamed as you're mounting an immune response. Why do all of your joints are so achy and swollen, it feels like, and just sore or painful or hurtful to move? That's why, okay? Because your body's mounting an immune response. It's inflammation. It's trying to limit fluid movement so it can keep it there, so it can attack this foreign invader. So skeletal muscle pump, respiratory pump, they're going to be key key to keep fluid moving forward in this lymphatic system. And that's all I'm trying to specify here. We start in lymphatic capillaries, we start in a capillary bed, and then we move closer towards the heart. So from lymphatic capillaries, we go and form lymphatic vessels. Where you find the arteries and veins, you generally find lymphatic vessels with them. Again, they're really small and you're not going to really see them. They're very delicate. They're easily destroyed. How do you know they're easily destroyed? You know, look at somebody who suffers from an extended period of surgery and they have to, you know, especially when it's in the upper body there, or if they have breast surgery, or if they have breast cancer or whatnot. Okay. There's always a massive amount of swelling that occurs within the arm and in the thoracic cage just because of the sheer amount of lymphatic vessels that are there and the destruction of them that can occur with various different types of surgeries. That's where you find these things easily destroyed. Okay. As you can kind of see, these lymphatic vessels can have all three layers, but it's like tunica intima is one layer. Tunica media is like one layer instead of a much more thicker layer. Tunica externa, it's not an extensive connective tissue structure. It's like one layer. So this is very weak and pathetic. They're still going to be dependent upon anybody else to contract and move them. Again, lymphatic vessels ride right along with an artery and a vein. Arteries are pulsable. So as the blood is pulsing through the arteries, it helps to rub up against and push that lymphatic fluid forward through the system. It has valves. So it's just like a vein. It has valves to prevent it going backwards. All right. So just like a vein, valves are also associated with lymphatic vessels as well. And on an exam, for whatever reason, everybody, well, not everybody, but 50% of people usually forget that for whatever reason. Okay. So again, like I said, they're going to be seeing a need for skeletal muscle contraction, respiratory breathing, pulsable movement of nearby arteries. Hell, lymphatic vessels ride right along organs. And as organs rhythmically contract, smooth muscle, that's going to help propel fluid forward through the lymphatic system. Along the length of these lymphatic vessels, where would you find them? I mean, you know, coursing through here, right? Coursing all over your body. As this lymphatic vessel is traveling along, let's say your leg or your arm or whatever, you will find a lymph node, okay? So if this is my lymphatic vessel, there'll be an expanded little lymph node here, and then it'll continue. And then another lymph node, and then here, and then another lymph node, and et cetera, et cetera. Ooh, my stomach. Lymph nodes are there for one thing, and that's for filtration. Lymph nodes are there for one thing, filtration, which leads to an immune response if needed. Okay, so if we do see a foreign invader, as it's traveling through this lymphatic system, it's going to come in contact with a lymph node. It's going to pass through a lymph node. And a lymph node, we'll see here in a little bit, is going to house some centers for an immune response. So these lymph nodes are kind of scattered all along the length of a lymphatic vessel. One of the functions for the lymphatic system was to mount an immune response. Here we go. So we started in a capillary bed and we taked up this excess fluid. Taking up that excess fluid allows the tissue to not be so swollen. Fantastic. Help maintain the blood volume. And it also allows this fluid to now enter into a system that can be checked, and double checked. The other function. As these lymphatic vessels continue closer towards the heart, they start to merge. Lymphatic vessels will merge into what is called lymphatic trunks. So we go from capillaries to vessels to trunks to ducts. Excuse me. The difference between a lymphatic vessel and a lymphatic trunk is that lymphatic trunks drain a region. Okay. Lymphatic trunks drain a region. We have, as you can kind of see here, 1, 2, 3, 4, 5. I know I asked a question, or I'm potentially asking a question on the exam, probably the best way to put it. Asking what some of these guys do. What some of these guys drain. Jugular. Jugular is draining blood from the head. So jugular trunks drain lymph from the head. Subclavian. Subclavian arteries extend out and go towards the arms. Subclavian trunks drain the upper limbs, the breast, which is important, and this superficial thoracic wall. Okay, the deeper stuff is the next guy. All right. Okay. So the subclavian trunks drain your arms and your breast. It's that axillary tail that feeds into that subclavian trunk right there. Okay. We have the bronchiomediastinal trunk, and this is your deep. Okay. The bronchus, the mediastinum, right? Where the heart resides, all that's deep. Okay. So the bronchus are within the lungs are deep. So these are the deep thoracic structures. Okay. And it's not paired. There's only one of these guys. Okay. Intestinal trunks drain the abdominal structures, really, for all intents and purposes. The very, very bottom of the abdomen can be picked up by the lumbar trunks, but you know, if you said abdominal structures there, I would accept that answer. Okay. Lumbar trunks are the lower limbs and basically the pelvis. Okay. And we have a left and right there as well. Okay. So we have jugular trunks, subclavian trunks, lumbar trunks, bronchiomediastinal, and intestinal. What all they drain, I know I asked maybe 1 or 2 questions associated with that. Lymphatic capillaries is where this fluid enters. We conduct it back towards the heart through lymphatic vessels. Lymphatic vessels merge and form what are called trunks. And these lymphatic trunks drain a region, the head, the upper arm, or I'm sorry, the upper limb, the lower limb, the abdomen, the deep thorax. Lymphatic trunks converge into 2 lymphatic ducts. The right lymphatic duct and the thoracic duct. These two large structures deliver the blood back into the general circulation via the subclavian vein. The right lymphatic duct dumps this lymphatic fluid back into the right subclavian vein, which then enters into the general circulation. And it's referred to as now blood again. It's fluid. It's water, okay? It's interstitial fluid, so it's more water than blood, okay? So this is just adding to the blood volume. What does the right lymphatic duct drain? The right side of the head. Right side of the head. Right side of the neck. Right upper limb. And the right hemithorax. Okay. Here to the diaphragm. Okay, to the diaphragm. All right there on up. So everything just on the right upper portion of the body, from the diaphragm on up. Okay, the right thoracic, right neck, right side of the face, right arm. So if you have blockage here, it's only going to cause swelling and inflammation really just in this little part right here. Just in this little part right here. There's your right lymphatic duct right there in that highlighted green region. Okay. Thoracic duct is everything else. Okay. You may potentially see that question on the exam as well. Okay. Thoracic duct drains the left side of the head, left side of the neck, left side, left upper limb, left thorax, and then everything below the diaphragm, the abdomen, and your left and right legs. Okay. It is the largest of your lymphatic vessels. It accepts a larger amount of lymphatic fluid. Where the right lymphatic duct drains into the right subclavian, your thoracic duct primarily is dumping blood into the left subclavian. Pretty easy. And here we've removed the lungs and the heart. So you can kind of see this thoracic duct right here. Okay. You can kind of see it coming up and dumping it into basically that left subclavian. It's right where the left subclavian and the internal jugular vein merge. But I'm just going to ask for left subclavian or right subclavian. Okay. Where it's dumping into. At the very bottom here, we have the very beginning of the thoracic duct. This is accepting lymphatic fluid from the intestines. This is accepting blood from the right lymphatic duct, or sorry, right lumbar duct, the left lumbar duct. So there's a ton of fluid entering at the very beginning of the thoracic duct. This very expanded beginning of the thoracic duct, excuse me, is referred to as the cisterna chyli. Cistern is just a big reservoir, and it's a big reservoir for lymphatic fluid. Excuse me. Okay. So if you're going to have a blockage in a duct, right lymphatic duct or the thoracic duct, which one would be worse? Anybody?
Thoracic.
There you go. Because we can have lymphedema where? Everywhere. Okay. If we have blockage of that right lymphatic duct, it's just sequestered to that right side of the head, right side of the neck, right side of the chest, right arm. Thoracic duct, if you have a blockage associated with that one, you can get backup of lymphatic fluid everywhere else. Okay, so that one would be the worst. That one would be the worst. And that's what lymphedema is. What is lymphedema? Okay, it is this. Okay. Swelling and pain in the infected area, and yep, that's lymphedema. Okay. If I asked anything off of that slide, I cannot remember. That would be all I asked. Okay. Basically, what's the definition of the word lymphedema? Okay. How do you do it? Moving. Okay. Compression socks. Okay. Compression garments. All right. Just getting them moving. Exercise is going to help push fluid forward through the system and prevent it from pooling up, or limit it from pooling up is probably the better way to say it. Massage. There's a technique with massage that allows you to move lymphatic fluid a little bit easier. It's a very light technique. Okay. You're not manhandling anybody with that at all. Okay. There are a lot of ways that we can damage these blood vessels through trauma, like I kind of mentioned with surgery. Radiation therapy can cause scarring of the lymphatic tissue and cause scarring of those lymphatic vessels, cause dysfunction of those valves, and you can get it, pulling up pretty easily there. So there's a lot of different causes for elephantitis, like I mentioned earlier, a parasitic worm infection that can get into those vessels and cause blockages in that regard there as well.
Does that radiation therapy scarring ever reverse itself, or scarring doesn't typically?
Scarring doesn't typically reverse itself. With some other tissues, you can use certain types of oils and creams to, if you do have some stretching of skin, if you use some oils and various different lotions that can give collagen fibers some resiliency, you can limit their limit their damage and their scarring that occurs. With radiation therapy, you don't necessarily, there's no ointment or cream that you could put on it to kind of get down there and be effective at all. Plus, it's only one layer thick, so it's not like it has a lot of redundancy built into it. So as soon as you damage those fibers associated with that thin little layer, it damaged it and it becomes essentially just non-functional. So would you have some fluid backup? Yes. That's where exercise, movement is going to become really important. That's why, again, they talk about, that breathing apparatus there when you're in a hospital setting. Why is that so important? Well, it moves blood, but it also moves lymphatic fluid forward through the system. And if lymph becomes stagnant, I can't mount an immune response as effectively. And now I have that region where that lymphatic fluid is pooling up, will now be prone for infection. So, getting up and doing those breathing exercises are so important for fluid movement when you're bedridden. When you have damage in terms of that kind of scarring through chemotherapy and whatnot, it depends on the extent of chemotherapy. My mom went through a few different bouts of chemotherapy and whatnot and radiation. And she had some, she had some lymphedema towards the end of that. She was always a little bit swollen kind of after that, for the most part. So it's something that doesn't really go away, but if you can stay moving, you can help keep that fluid going forward through the system.
Yeah, I was remembering my grandmother. She had cancer and she had radiation treatment, but not chemotherapy. And at one point, one of her arms was swollen, but I think it did go away. So I don't know what that was, but it must have.
And I know with rehab, when it comes to, well, especially now, there's a lot of other kind of conjunctive therapies that usually go hand in hand with different types of cancer treatment centers. And so there's going to be some exercise. There's going to be some compression that is worn. I know my mom had to wear compression there. So she would wear a compressive sleeve. Not, nothing like a basketball player or anything like that, but it was just something that provided a little bit of pressure. And it's just that little bit of pressure that allows that fluid to go back forth through the system. It's only if you have massive destruction where you would see, some significant lymphedema associated with that. And that's going to be more associated with a lot of surgical interventions as they try to kind of get to the anatomy to cut and remove. That's when they're going to damage a lot of stuff. Hell, I knew this. I had this one patient. She had a knee surgery. The most mundane of procedures anymore, right? We do 1 billion of them a year. We're fantastic at them. This physician, the surgeon, he didn't like how her leg was laying. It was kind of just, as she's laying there, like on the table, this one leg was just kind of winging off to the side a little bit more than the other one. And so he's like, well, I'm going to fix the structure. Well, when it comes to how the leg is laying, it's more than just the knee. There's also where it attaches in the hip, at the ankle. So if the hip's off and whatnot, then if the hips are splayed out a little bit more, so if she has a little bit wider hip, that femur is going to ride up with that acetabulum, and the foot is going to kind of wing out a little bit more. So he went in and he was like, I'm already manipulating the leg, so why don't I turn it in a little bit more? And now, the foot pokes straight up. Well, just that little bit of shift that he did when he was trying to straighten out the structure of the knee to straighten out how the foot was laying, took that lymphatic vessel and cinched it off just a little bit. And that was enough to cause, she had massive lymphedema in her leg because of that one little action. So these are structures that it doesn't take a whole hell of a lot to screw up. But when you do screw them up, which happens quite a bit within surgeries, you can get some massive lymphedema. Yeah, ouch. Yeah, I mean, that's why, wearing shoes for all of you that are going to be nurses or on your feet all day long, wearing, I wear compression socks sometimes if I'm going to be up on my feet a lot. I wear them when I train sometimes. It just helps keep blood, or keep fluid moving forward through the system a little bit more. So if you're going to exercise a lot, or if you're going to be on your feet all day long, wearing those compression socks can be so helpful. It's just that little bit of constriction that occurs there that allows that fluid to get pushed forward through the system a little bit more. Okay. We have a handful of tissues and organs that are associated as lymphatic in nature. Okay. We divide them up two different ways. Well, one different way. Do they form the cells associated with the lymphatic system? Okay. If they are involved in the formation / maturation of a lymphocyte, they are primary. You have only two primary lymphatic structures: red bone marrow and the thymus. And we'll talk about these here in a second. Everything else is secondary. Lymph nodes. Palpate and feel those right there. Okay, just find the line of your mandible right there and just go right underneath it. Okay, and you can palpate and feel. Okay, you have them. Find the back of your head there, the base of your skull. You have some posterior cervical lymph nodes right here. You have a posterior cervical chain right here, going down either side of your neck. Okay, going down either side of your neck. Those are your lymph nodes. Those are secondary structures. They do not form lymphocytes. They just house them. Okay, they just house them. Where we're going to cause the immune response, or where the immune response is going to initiate. The immune response does not initiate in bone marrow. The immune response does not initiate in the thymus. They're only involved in making them. Spleen, tonsils, some diffuse lymphatic tissue, all of this, lymphatic nodules, all of this is secondary lymph structures. Oh my gosh, I need to sneeze so bad. Okay. Primary structures form lymphocytes. Secondary structures do not. That is the difference.